Hello, hi everyone. Thank you for joining my channel. This is Dr. Erica coming back to you on a live chat. Thank you for joining me. I just want to say Happy New Year to everyone, and I hope everyone had a wonderful holiday this 2022 season. And I just want to briefly update you on some things. I have some postcards for Millennium Pharmacy that I have worked on, and that includes my contact. And this is the Millennium Pharmacy postcards that I have, and I do want to pass out here and I'll put the information in the comment section about my contact if you don't already have it, and it's already available on my channel as well. And for today's topic, if we may get into it, I'm going to talk about mental health and behavioral health and what is available as far as counseling and receiving non pharmacological therapy, and which we always want to um, seek first is the non pharmacological therapy before starting treatment with medications. So, just to start off, mental health is very prevalent in our society in the United States, and particularly there are there are signs of mental health that can help prevent further action that may contribute to a person who is thinking about taking their life or taking another's life. We want to make sure that we are talking consistently with our family members and with our friends and keeping up to date with what's going on in our lives and sharing our thoughts and our past events with someone that we truly trust and that we truly can interact with and learn from and pull from. And so that's what I want to talk with the community about on today: mental health. So there are behavior modifications that are available that are recommended for patients who may have addictive therapy or addictive behaviors, or um, behaviors that are not appropriate, that may hinder or stop someone from thriving and living a good quality life. Okay, and I also found these encyclopedia books that I'm very proud of. I got a set of four from the local library here, and health and medicine. And there's a encyclopedia, it's a set of four. So I pulled these out here recently and have been reading on have been reading on actual topics. I just want to show these to you. I'm very proud of them. A lot of the material throughout the years stay the same as far as the anatomy of the body, uh, natural and herbal and minerals and trace minerals. All those things stay the same throughout the years. Our body anatomy doesn't change, so it's good to keep a set of these on board. And I'm glad that I was able to open and actually go back and find out some good information. So, and it talks about medications too. So I was glad to see that. Okay, so behavior modification, I'm just going to read this small paragraph to you, is formally structured care through a licensed psychologist or substance abuse professional, and takes the approach that a person can change the ways he or she thinks and acts in regard to alcohol and drugs of abuse. Methods may include incentives, setting, and then working to meet goals. Our 2023 year is to set goals for our own life and to set new standards for ourselves, whether tobacco cessation, whether it be alcohol, cessation, or maybe it's an addiction that we've acquired in our lives that might not be pleasing in everyday living, and that may not bring the best out of our talents and our behavior. So we want to make sure that with this new year that we're implementing new strategies for good quality living. Okay, so methods may include incentive setting, then working to meet goals, behavior substitution skills, psychotherapy to help the person understand his or her reasons for abusing these items, education, techniques for coping with situations that present high risk for relapse. Behavior modification therapy builds on the premises that the individual is responsible for his or her behavior. Behaviors are learned, and learning new behaviors is always possible. So, with that being said, whatever the challenge may be in our lives, mentally, psychologically, dependent on things that may not be healthy from day to day, that may not be nutritional from day to day, that may not be um, physically giving us that physical activity that we should be implementing from day to day, staying strong, staying mentally healthy, eating good nutritional diets and proportions and things like that. We want to make sure that we are at our best health at all times. Okay, so I just wanted to read that paragraph to you. Um, Depression is part of mental health, and it can be severe, and if it is prolonged, um, or if it's detectable and then able to be treated, there are some medications that a pharmacist can recommend at small dosing, and then there are some medications that can help treat any underlying condition that that may be causing the depression. It may be weight gain, or maybe postpartum related, or maybe post-traumatic related. If we can help with the underlying condition, then maybe we can um, elevate and help our minds to be better. Okay. So do be aware of that. And again, I'm very proud of my encyclopedia books here that I have, and my postcard. So I wanted to just show these to you. Okay, Millennium Pharmacy, and my contact information I have listed on the card as well, and they will be dispersed here in the city of Mobile. So I do want to reiterate that there are help opportunities that are available to those patients who may be considering harming themselves or taking their life or someone else's life, which is not what we want. And do be informed that there are resources that are available: counseling, family therapy, just sitting down with someone that we trust, and someone that we can confide in from time to time, just to make sure that we are doing our best and being our best selves. Okay, so thank you for joining me on this video. I don't think there's anything else that I want to mention. Just to encourage everyone to have a happy new year for 2023, and I hope 2022 was pleasant and was everything that we wanted it to be. Okay, and I'm Dr. Erica, and I'm signing off, and I'll see you on the next video. Bye bye.